Right, November is called Movember and is a time to help raise awareness on men's health issues. Now, most of the time, women's health tends to dominate discussions with talks of breast cancer, cervical cancer, and other diseases faced by the group. However, men's health is not as regularly discussed, particularly prostate cancer. Now, though prostate cancer may not receive much attention in the media, but breast cancer, for example, it is nearly as common, affecting about 1 in 8 men in their lifetime. And get this, about 34,700 men will die from prostate cancer, the most deaths from any cancer in men after lung cancer. So what is prostate cancer? Now, joining us today is Dr. Ruthresh Subramanyan, National Cancer Society Malaysia Medical Officer and Head Promotion Lead, and to give us some insights on this topic. Now, welcome, Doctor. So, what is actually prostate cancer?
All right, thank you so much for having me here today, Bernama. Right, so talking about prostate cancer, prostate in specific is actually a gland that is actually located below the urinary bladder, and it's actually in front of the rectum in men. And its primary function is actually to produce seminal fluid, which nourishes and transports sperm. So prostate cancer occurs when actually the cells in the prostate gland mutate and start to multiply uncontrollably. So these cancerous cells can actually form a tumor, and in some cases it may actually spread to other parts of the body. So that's basically about prostate cancer. Yeah.
So how dangerous is it anyway?
So prostate cancer is, the danger level is varies, all right? It's actually often a slow-growing cancer, and many men with low-grade prostate cancer may live for years without experiencing any significant symptoms or seeing the cancer spread. However, some forms of prostate cancer can be aggressive and may metastasize to other parts of the body, all right? So this may pose a more serious threat, and the danger level is assessed based on the factors such as the stage of the cancer, which is the extent of the spread, and also there are some certain scores or certain assessment that we see, and most importantly, we actually measure the level of prostate-specific antigen, which is a tumor marker in specific for prostate cancer.
So about age group, how young can a man actually be diagnosed with or have prostate cancer? Is there any age limit or a starting point?
All right, so to specifically say an age limit, it is actually a disease of the older age, all right? So the risk actually increases after the age of 50, and the majority of cases are diagnosed in men over the age of 65. Family history and genetics also play a role with men who have close relatives such as their father, grandfather, or brother diagnosed with a prostate cancer at a younger age. So these are those category people or in the community that actually have an increased risk of getting prostate cancer. So it can be even sometimes in some cases as early as 30 to 40 years old. Yeah, we have been diagnosed. We have diagnosed a few men with that.
So about prostate cancer and how actually, what actually causes prostate cancer?
How do we screen for prostate cancer, right? All right, so in terms of screening for prostate cancer, we have two major screening methods. Number one, which is the most common, is actually the PSA, which I mentioned earlier, which is the prostate-specific antigen. It is the level that is actually in the blood measured. It is something that is specific. It's a type of tumor marker that actually indicate the presence of the prostate cancer. So even sometimes it can also able to detect other conditions like even the hyperplasia of the prostate. And some of the most common way or the easiest method is actually just by a physical examination, as simple as a digital rectal examination. It's a physical examination of the prostate through the rectum, which can help to detect any abnormality.
So any prevention measures actually can be taken to prevent prostate cancer from occurring, or it will just happen?
All right, so prostate cancer doesn't just happen, all right? So it requires a lot of prevention measures. Okay, how are the simplest prevention measure that you can go through is, adapting a very healthy lifestyle, like rich in fruits, vegetables, whole grains, and also most importantly, the carcinogen that we have detected is actually smoking. So avoiding smoking and also consumption of excessive alcohol itself already reduces the risk of developing prostate cancer. And also the most important part is actually having the awareness and also able to go for early detection. So if you already have a family history of prostate cancer, or even a benign prostate hyperplasia, we urge the community or the men to actually go and get themselves checked, especially if it is possible to do a digital rectal examination. And the best would be actually to just simply take a blood test to see your PSA level, the prostate specific antigen. So this would be the most easiest way to actually prevent the prostate cancer or to actually detect it earlier.
Okay, thank you, Doctor, for such a insightful topic we're talking here. So anyway, thank you for joining us today.